Hello everyone. On behalf of Idare Talim Wagahi, I welcome you all to today's session on early years, titled Early Years Learning in COVID-19, Global Response and Adaptations in Pakistan. My name is Sabah Saeed, and I'm the Senior Program Manager with ITA. The objective of this session is to bring together experts, practitioners, researchers, and policymakers working directly or indirectly on early years to discuss the impact of COVID-19 on young children and their families, and share practical approaches that might be adapted in response to the COVID-19 crisis. Without further ado, I will hand this over to Bela Raza Jameen, CEO of ITA, who will reflect upon the status of ECE and ECT as a result of COVID-19 and will highlight the emerging issues in early years policy and practice. Over to you, Member.
Good evening, good morning, good afternoon, everyone. Assalamu alaikum. It's absolutely sheer delight for me to be welcoming all of you to this wonderful webinar with an amazing galaxy of panelists and speakers, and also, of course, the participants. We have been looking at this space for a long, long time. In fact, ITA began with a huge investment, emotional, intellectual, and of course, in terms of research investment in early childhood education in 2000. Come the COVID pandemic, we know that whilst we've been hearing the figures of 1.6 billion children, students and learners, and 186 or 90 countries affected by the global pandemic, we often forget that we are talking also about a large number of more than 40 million children in the 3 to 5 years age group. And of course, much larger if you look at the 0 to 8 age group, who will suffer and are suffering the kind of losses that we can't even imagine. This is this time when a completely holistic approach to early stimulation support is desperately needed for the child to meet several milestones of age-appropriate development, not the least of which is through play-based learning and stimulation, and with environments which are relatively stress-free. COVID, of course, has brought with it a health crisis, an economic crisis, and of course, the learning crisis that we hear so much more about. For the child that we are talking about today, it's all of those that affect the child almost fundamentally. And of course, as we speak about issues of learning losses, this is the foundational period where learning losses can be so foundationally riveting that the havoc caused now, perhaps as some of our researchers like Andrabi and Das have looked at 14 weeks of learning losses leading to 1.5 to 2 years of learning losses of a permanent nature, we are talking about something very severe for the early years. We also know, sadly, that in the countries themselves, in our own countries, whilst we all believe optimistically that the moment for early childhood education has arrived, we also know when we start looking at our dollars and cents that the allocation to education and early childhood care and education has been very low. And it was just beginning to get attention when the COVID pandemic has struck. And we already know from the Global Education Monitoring Report that 2018 saw a high of aid for education. And even then, the resources allocated under aid for education for early childhood were very, very low. What is going to become of issues of financing of early childhood? What is going to become of those parents and households who are under so much stress? And Evelyn from ARNIC will share more about the research taken in the region, that we're looking at almost 70% of the families under extreme stress, and that is no good for children who are at 3 to 5 years of age. The desperate need for play-based learning, for stimulation by parents who are at least some mode of being in a stress-free nature, that in itself is a very big issue, and we'll hear more on that. But at the same time, there is a ray of hope where we've seen some amazing stories of how parents and children have come together, how caregivers have come together to support the early years through different ways of play-based learning, which in many ways take away from the usual paradigm of education for early years to a completely new norm of children being with their parents and caregivers in much more friendly and closely bonded situations where perhaps there is some ray of hope. In the sector plans, in the discussions in which I'm a part of, in Pakistan, as well as in other parts of the world, there is a question of learning losses for primary, middle, secondary, but there's very little conversation going on for early years. We are pleased to see when we hear from UNICEF, from the UN Secretary General, from INEE, from Lego Foundation, from ARNIC, from other partners, a big support and a big shout out for early years. We believe that this will be a very important webinar for us to start a journey where we can become a very important lobby for foundational learning, for foundational support in meeting the milestones of early years development, and to see how we can raise the flag for early childhood education from today and from the recommendations that come out of this. And we hope all of you who are with us today will become the flag bearers of this very important age group that I think in the new normal, we should begin to talk about education right from the early years and then talk about primary and so on. Maybe this is one way of redefining our education space, starting from the beginning, where all means all. Thank you very much. To at this point introduce our moderator, Dr. Munazza Aslam, who is an education economist. And frankly, Munazza has worked so comprehensively in education, not just as an economist with early years, with schooling quality and access issues, teacher effectiveness, and role and impact of private schools in Pakistan, and of course, in other low resource settings. She has extensive experience in collecting primary data and conducting purpose-built, school-based and household-based government and primary schools research in several developing countries. Munazza brings to you an amazing amount of experience and of course, her diligence as an economist and as a caring researcher will, I think, do justice to this webinar. Over to you, Munazza.
Thank you very much, Bela, for your kind words. I think it's a very exciting opportunity for us to hear from a very distinguished list of panelists. So I will try not to take too much time. I think this topic is quite close to our hearts. I mean, one thing that really struck me is what Bela just said about how, you know, the COVID-19 crisis is both a health, is actually threefold. It's three-pronged. It's a health crisis, it's an economic crisis, and it's a learning crisis. And one of the things that I remember somebody saying, which has really impacted me, is that for years now, we've been talking about a learning crisis in education. I think today we are actually pretty much in an unprecedented learning crisis. And if learning starts from early years, our focus needs to be on that. And a conversation we were having in preparation for this webinar also struck me was how the early years agenda seems to have almost become marginalized. And that's something in the gains that we have made over the years, we really don't want to lose them. So I think this is a great opportunity for us as practitioners, as educationists, as researchers to engage and hear some of the views emerging from leading researchers on this very topical issue. Without further ado, I'd like to just kind of introduce the distinguished set of panelists that we have. who are talking about some very important issues today. So the topic under discussion today ranges from the role of parental engagement and interventions to learning through play to, for example, addressing the impact of COVID-19 on young children. Now, for your interest, we have divided this webinar into two broad sessions. The first half of the webinar will cover the more global picture, and the second half will cover the national context. Also, to keep audiences engaged, we will ask the first three set of presenters to present and then open up the floor, which means through the comment boxes, some question and answer sessions. The second half of the presentations will follow with a more greater focus on the regional, South Asia region and Pakistan focus. And once we've conducted those, we will have Q&A sessions for those. Before I introduce the panelists, I'd also like to remind everyone, I mean, you are welcome to just type up your comments or anything that takes your interest in the comment boxes. And after the first half, after the first three presentations, the ITA team is going to put up the questions that you have posed or important comments for us to discuss. Before we move on to the second half of the webinar, I'd like to invite one of our presenters, Sean Powers from the World Bank, who is the guest speaker, to just provide some insights from his side on the first three presentations, or generally on this topic. Now, just briefly, because I don't want to take all the time, I'd like to introduce the panel. Excuse me. The first presentation is going to be by Evelyn Santiago, who is the Executive Director for Asia Pacific Regional Network for Early Childhood, which is RNEC. She has more than 20 years of professional experience in development work encompassing child development, investment programming, and strategic planning, project planning and design. And she comes with a huge expertise in this area. The second presentation in the first half of the webinar is going to be conducted by Dr. Hirokazu Yoshikawa, who is the Professor of Globalization and Education at New York University and the co-director of the Global TIES for Children Center at NYU. He is a community and developmental psychologist who studies the effects of public policies and programs related to immigration, early childhood, and poverty reduction on children's development in the US, as well as in low and middle income countries. The final presentation in the first half of the webinar is going to be conducted by Dr. Amy Jodoud, who is the head of evidence at the Lego Foundation, where she oversees generation of evidence about the critical role of play for children's development, creativity, and lifelong learning, and its importance for systemic change. As a member of the leadership team, she is also leading the Foundation's COVID-19 response on distance learning. After the first three presentations that broadly cover the Asia Pacific, the Middle East, and more global context, I will, as I said, open the floor for questions and answers. I'd request the participants to keep their presentations to no longer than 10 minutes to allow for rich conversations. I'd then like to invite Dr. Sean Powers, who is an economist in the Education Global Practice of the World Bank. He leads a multi-country research program in early learning systems under the bank's Early Learning Partnership, and has worked at all levels of education from early childhood development to higher education. Once we have completed our first half, this set of presentations will then be followed by the more regional focus, with the first presenter in the second half being led by Dr. Nadia Siddiqui, who has academic expertise in education, research, and equity in education. She is currently leading the British Academy funded study on early childhood development and the role of schooling in India and Pakistan. And she investigates the indicators of disadvantage that determine children's academic attainment, well-being, and happiness. Sorry, just give me a second. And then after this, we will have Dr. Amna Ansari presenting. She is an early years fellow for Pakistan with the World Bank. Previously, Amna was leading the Punjab province's early childhood education initiative, including the development of the province's first ECE policy and first provincial ECE curriculum. She has also been closely involved in other aspects of ECE, such as ECE teacher training, development of teacher learning materials, and quality assurance mechanisms. The final presenter in the second half is Abdal Mufti, who is currently serving as the head of research and policy wing at PMIU, School Education Department, Punjab. As an education practitioner, Abdal has led multiple interventions aimed at improving the quality of education service delivery in public domains. He is currently overseeing the implementation of the World Bank funded third Punjab Education Sector Reform Program. After these three presenters have presented their work, not taking more than 10 minutes, We will again open the floor to questions and answers in the comment boxes. And the final guest speaker I'd like to invite is Madiha Ansari, who is the founder of Cities for Children, which is a non-profit organization that seeks to protect the right to a childhood, the right to read and play and feel safe. Her work has involved crafting innovative programs, promoting learning, mental health and well-being for street-connected children, working in partnership with schools and protection centers. So as you can see, we have a huge range of very, very distinguished people. I'd like to just invite Evelyn to start, and please try and stick to the time. Thank you.
Can you see my screen? Can you see my screen?
Yes.
All right. Yeah. Okay. Good morning, good afternoon, good evening, everyone. I'd like to thank ITA, Bela, and the rest of her team for giving Arnec the opportunity to be part of this webinar. For those who are not familiar with Arnec, we are a network established in 2008 with the core objective of advancing the agenda on and investment in early childhood development. Our main focus is promoting holistic and inclusive ECD. We work in partnership with global, regional, and country-level organizations whose focus is aligned with Arnec's mission of promoting holistic and inclusive ECD. For this presentation, there are 3 key points or messages which I want to make. First is that COVID-19, as Bela said earlier, has really a significant impact on young children and their families, but more so on the situation of the most vulnerable and marginalized groups of young children in this region. Second, amidst the great challenges of this pandemic, countries have been implementing practical approaches, innovations, and strategies to support the needs of our young children and their families. These practices are good starting points, but more needs to be done. Third, and most importantly, we need to elevate the issues of equity and disparities affecting young children from the most marginalized families and communities. If we fail to do this, then more children will be left further behind, causing a long-term impact on their development. For us, we need to have a stronger advocacy on this. Back in April, Arnec commissioned a rapid survey which aimed to generate the views of the regional ECD community on the impact of COVID-19 on young children and status of ECD. From this survey, we have generated insights from 30 countries, and I will be sharing some of those results with you in the following slides. One of the survey findings is that families are experiencing significant level of stress due to the pandemic. In countries like Bangladesh, Pakistan, India, and the Philippines, the respondents were saying that the situation is worse off, with more than 70% of them indicating that families in these countries are under significant stress. With heightened level of stress experienced by the families, survey respondents also indicate that families are having difficulty coping, especially those from the South Asia sub-region. Amongst many factors, survey results indicate that income losses, closure of school and ECD centers, and prolonged homestay are top reasons for family stress in the region. In some countries such as India, the Philippines, and Bangladesh, food security is significantly contributing to family stress. The rapid survey also indicates that COVID-19 is having a significant impact on the nurturing care of young children. On the health front, there is a reduced access to basic health services such as child immunization, for example. On nutrition, respondents highlighted the issue of food insecurity and the disruption to school or center-based nutrition programs. On responsive caregiving, the stress brought about by the pandemic is highlighted, especially for working parents who now have to take on greater role on looking after their children 24/7 as schools and ECD centers are closed. Respondents also highlighted the increased vulnerability to domestic violence and child abuse. The increased screen time of children coupled with lack of parental supervision might also lead to increased vulnerability to online sexual exploitation during the pandemic. Finally, COVID-19 has a significant impact on early learning opportunities, as the closure of schools and centers has disrupted learning routines. While many have shifted to online learning at the confines of their own homes, the challenge, especially to the most vulnerable groups, is that not all can actually have access to internet, and not all have educated parents or caregivers who can support their children in this new mode of learning. The extent to which this pandemic has affected and is affecting young children is different for the most marginalized families and communities. They bear the heavy pandemic burden. This is true for children with delays and disabilities, children living in poverty, those living in informal settlements, as well as those in rural and remote communities. The level of difficulty is also greater for those young children of refugees and migrants and children of ethnic and linguistic minorities. To begin with, these groups are already in disadvantaged positions prior to the pandemic, and the pandemic only worsens their situation. To support the ECD community during the pandemic, ARNEC immediately organized a webinar series on young children amidst COVID-19, which focused on practical experiences and innovations undertaken in the countries to address the impact of COVID-19 on young children and their families. Through these webinars, we are able to generate country innovations, approaches, and strategies, which demonstrate ways on how parents and caregivers can be supported during this pandemic. We have seen, for example, good practices from mobile creches in India, BRAC in Bangladesh, and Child Development Center in Hong Kong in addressing the needs of young children from vulnerable groups such as migrant workers, those in refugee camps, and those with special needs and disabilities. We have also seen how in the Philippines and Pakistan, organizations like the ECCD Council, UNICEF, and ITA were able to quickly develop innovative play-based learning activities which parents and caregivers are able to use at home to engage their children in meaningful ways. We have also seen some innovations in Malaysia, Indonesia, and India in supporting parents and caregivers, frontline workers, and volunteers through various parenting education programs shared in different platforms. Multi-agency collaboration was also evident in Malaysia in disseminating parenting resources, and in India in developing what they call COVID-19 Academy. There were also a lot of strategies which showed how organizations in India, Vietnam, and Philippines, among others, have really maximized the use of technology and platforms to be able to reach parents in different communities. Details of all these country approaches and innovations can be found in the ARNEC website. Most recently, ARNEC organized a webinar with senior government officials focusing on ECD equity and inclusion challenges as the country starts to transition to the new normal. In this session, we've heard different strategies which governments are undertaking to address equity and disparities in ECD. For example, we have seen ECD included in COVID-19 education recovery plans in Cambodia, Indonesia, Nepal, and Bhutan. Community mapping is done in the Philippines prior to reopening of schools and ECD centers to assess vulnerability of young children. Use of offline media to reach the most vulnerable groups is widely used in Cambodia. In Indonesia, there was an enhancement of social protection funds for vulnerable groups. In Nepal, the parenting education programs has been widely implemented. And in Bhutan, the Ministry of Education is covering the salaries of private ECCD facilitators to ensure that they don't leave. In China, there was a strong engagement of the private sector in providing support to the most marginalized communities. These initiatives need to be recognized. However, much more needs to be done if we are to really address the impact of the pandemic on the most vulnerable groups. ARNEC recommendations highlight the need to continue supporting holistic and inclusive ECD so we are able to protect the gains of the ECD-related targets in the SDGs and as much as possible, reverse the losses due to COVID-19. We highlight 4 areas where we think government intervention should focus on with strong support from donors, NGOs, and other ECD stakeholders. First, there is a need to have a strong focus on family support, parenting, and responsive caregiving. Addressing equity issues affecting the most vulnerable groups. There is also a need to support intersectoral policy reviews, and reforms as we need to ensure that ECD cuts across sectors to make it more resilient and sustainable. And fourth, we need to protect ECD budgets and advocate for ECD investments as different sectors are now competing for very limited resources and funding for recovery interventions. From our end, we commit as your regional ECD network to undertake the following. We will continue to provide you with a platform for cross-country sharing and learning through webinars, roundtable, and panel discussions. We will facilitate the establishment of learning groups and communities of practice to allow in-depth sharing and learning amongst countries based on specific ECD issues affecting young children during this pandemic. Undertake in partnership with research institutions and academe some case studies which will generate evidence on the situation of the most vulnerable groups of young children and their families. And we will develop and disseminate advocacy materials and will find ways to engage policymakers in charge of ECD in the countries. We cannot fail our young children. We need to really work together to ensure that ECD is prioritized in COVID-19 response, recovery, and preparedness plans of the countries. Thank you, and I look forward to the discussions.
Thank you very much, Evelyn, for that, and beautifully timed. I would like to now invite our second presenter, Dr. Yoshikova, to present, please.
Great. Let me share my screen. Can folks see the screen?
Yes.
Okay, great. Thank you. Jumping off from the call for parenting interventions by Evelyn and the array of examples, very rich examples across the Asia-Pacific region, I'm going to give a little bit more detail on just a few examples from Latin America, the Middle East, and South Asia, focused on parenting. So I'm actually not going to go in much detail on these points because they were already well made by Evelyn and by Dr. Bela before. So these are multiple crises. There are, in addition, mental health and well-being challenges for parenting, including the risk of violence in the home, which we hear from multiple countries is reports of increases. The closing and disruptions of existing ECD programming, placing additional burden on families, the lack of access to internet for things like remote or distance interventions, and I think coming up and already occurring in some places when programs reopen, the challenges of social distancing and prevention of COVID-19 for an age range of very young children. In this presentation, I'll give examples of interventions building off platforms such as national broadcast or regional broadcast, TV, radio, WhatsApp and phone-based parenting interventions that are implemented at some form of scale in Peru, the Middle East, and in Bangladesh. So just to give the first example, in Peru, internet access is, as in many low and middle income countries, very, very low in rural areas and not that high in urban areas, even in the capital of Lima. So what the Peruvian Ministry of Education established and launched in, I believe, it was late March or April, was daily broadcasts with set times for pre-primary, lower primary, upper primary, and secondary, with curricular content that rotates across days and weeks. For pre-primary, they worked with Sesame Workshop to include the Latin American version of the Sesame Street program in their broadcasts. And they made the broadcasts and materials available specific to age ranges within ECD, within primary, and within secondary. And so there was a kind of a developmental specificity to their learning materials. And so this gives a sense of how this looks on their website and the schedule, if you click on their website for the radio and television programming. This was a child watching some of the first day of pre-primary classes. In addition, they have a variety of video, internet, and illustration content about COVID behaviors like this, as they look in both rural and urban settings, play activities, and then a schedule, which is interesting for how, when the school year begins in the fall of 2020, that they will do evaluation of children's learning skills. So the intent is then to target instruction to children's level of learning, realizing that some children may have fallen further behind in their learning than others. So this is a concept around instruction at the child's level of learning, which is akin to the teaching at the right level model, which is quite well known. Turning to the Middle East, Ahlan Simsim is the partnership between Sesame Workshop and the International Rescue Committee to provide ECD services in 4 Middle Eastern countries, Jordan, Lebanon, Iraq, and Syria. And this program originally focused on in-person, on-the-ground services in areas of parenting services as well as early childhood learning programs, but has pivoted to both WhatsApp and phone-based interventions in the last months. So one intervention that is starting to be rolled out in all 4 countries, it's a WhatsApp text message intervention in Arabic for all caregivers with young children, with daily texts accompanied by a variety of modalities, such as illustrations, audio messages, or links to videos on a large-scale global messaging platform. We are currently testing through what's called a MOST design, multiple features of implementation, such as the modality of the attachment, the time of day of the message. There are interests in testing dialect versus modern standard Arabic, and accounting for inclusion and literacy levels at the beginning of this implementation. This is an example of a message that is about using home materials to create a play activity out of bottles and dishes and bowls that might be familiar to many of us from parenting interventions, received as a text message with an accompanying illustration. Then turning to phone-based, the Reach Up and Learn team, Susan Walker, Christina Powell, and others have been engaging in adapting the Reach Up and Learn home visiting curriculum, which is for 0 to 3-year-olds, to adapt to the COVID situation of phone-based support for responsiveness and stimulation and nurturing care. So trained community health volunteers in this case in Jordan are using an adaptation of Reach Up and Learn that was led by Manar Shukri and Ayat Al-Akra at the IRC to provide COVID information, check-in and strategies, a caregiver well-being check-in, and selected Reach Up and Learn activities. Not all of them were feasible to accomplish in the home, just with support through a phone call. So they have selected the Reach Up and Learn parenting activities that are most feasible. And this is targeted to the 0 to 3 years and being implemented in Jordan with an impact evaluation that we're planning to start in a couple months. Finally, turning to BRAC, their work in the Cox's Bazar area of Bangladesh, where there are close to 1 million Rohingya refugees presently, as well as a very large host community. They have developed a phone-based response tele-intervention called Pashiachu, or Besides You, which includes outreach and training to caregivers of small home-based childcare centers out of the BRAC Humanitarian Play Lab model. They have about 1,400 of these caregivers, and so they have trained them to reach out to all the caregivers in their programs, which got shut down when COVID-19 hit. And to talk to their children. And so what is interesting here is that the 20 minutes teleconversation includes conversation not just with the caregiver around their well-being and learning through play activities, but also a conversation with the child who knows these play leaders, and so they engage with the children as well. It turns out about 80% of the Rohingya refugees have access to phones, and so they have been calling close to 38,000 caregivers and children every week with weekly phone calls. This is an integrated curriculum that incorporates mental health and crisis intervention techniques from interventions such as phone-based crisis intervention counseling, as well as play-based learning curriculum developers, with trainings conducted often themselves remotely because the Play Lab leaders live themselves in the camps. And so can't be brought together easily in group trainings. So trainings are conducted often remotely or by phone. This is a community capacity building model with a cascade model for training to reach scale. From BRAC's perspective, a new dimension for women to use telecommunication and technology for work in their Play Lab leaders workforce. Just to end with some cross-cutting implementation and evaluation issues, what is especially challenging is while quote-unquote non-essential services that are often the non-health services are interrupted or closed, at the same time, we need a new kind of integration of health, nutrition, protection, and education with an unprecedented focus on basic needs, mental health, as well as nurturing all the other dimensions of nurturing care. One aspect that is coming up across multiple countries is that well-being and stress of the callers and phone-based interventions is an issue. And so in addition to professional development needs, they have their own mental health and well-being needs because they are often exposed to the same kind of COVID-19 related risks as the target populations whom they serve in the early years. There's a great deal of variation in household control of digital technology or a phone, who has access to something like a phone. And so that is both an opportunity to engage multiple caregivers in the household, but also presents challenges if you want to reach all of the caregivers in the home. With variation in reopening levels and reclosing, there will be also the need to really understand the best ways to implement hybrid models at scale, how to address the loss of learning and variation in learning levels across children, and the fact that we have a very small evidence base to work from for some of these modalities. For example, phone-based ECD interventions, which are now the norm in many, many countries. There is not much of a evaluation literature on those, let alone an M&E literature to understand how to measure quality. And that is something that we are working on at NYU with BRAC, with the IRC, with regional partners and governments to develop quality based on, for example, recordings of phone-based ECD programs that could then inform supervision and monitoring systems. So I want to thank the many partners here across the Play to Learn and Ahlan Simpson initiatives. Thank you very much.
Thank you very much for that very useful and interesting presentation. Can I ask Amy Jo to please present hers now?
Okay, can you see my screen?
Yes, I can.
Fabulous. Let's see. Okay, problem now is I can't see the chat box. All right, so I'm Amy Jo, and I'm the head of evidence at the LEGO Foundation. Very pleased to be here and want to build on the presentations of Evelyn and Hero before me to really talk a little bit about the work that we've been doing in learning through play during COVID-19. In case you don't know, the LEGO Foundation is a Danish foundation, and we aim to redefine play as well as to reimagine learning. So we join efforts with partners across the globe to implement programs and to do research and do advocacy based on the programs and the research, all in the service of making children's lives more playful and enhancing their learning and development. So that is together we seek to ensure that the fundamental value of play is both understood as well as embraced and acted upon. So I wanted to start today by asking you actually in the chat box to insert one of your favorite ways to play. Oops, not sure if I can do it. I guess I can't see it if I'm sharing. So I'm gonna assume here somebody's writing in. If I could type in, I would type in playing cards because I love playing cards. And then once you're there, I'd like you to think about what kinds of skills you might develop while you're playing it. Again, for my example, playing cards, I might use some math. I might have to regulate my emotions if I'm winning or losing or hiding a great move, these kinds of things. And so one of the things that is important to us at the foundation is to really recognize the vast variety of ways that there are to play. And the ways that hopefully you're seeing in the chat box that at the moment I can't see. There are many skills that you might be learning as you're playing in this different variety of ways. And so this is why the LEGO Foundation takes a very holistic view of skills and highlights the importance of children's physical, social, cognitive, creative, and emotional skills, and how these complement and interact with one another, especially when we play. Our evidence base also shows us that playing is joyful and actively engaging. It's socially interactive, iterative, and meaningful. And that is the way that children, these interact with each other and complement each other as children are playing. And especially as parents and educators, we're anxious during these challenging times to ensure that children experience such moments of joy and surprise, of meaningful connection, being active and absorbed with one another, iterating and engaging with others as they both play and they learn. Our research further suggests that playful learning experiences that contribute to develop these broad and dynamic interconnected skills, and that there are a spectrum of ways that adults in children's lives can facilitate this learning. So the spectrum goes from child-chosen free play on one end to teacher or parent facilitated games and guided play in the middle, all the way over to teacher-led instruction on the far end. This is what we call our spectrum of play facilitation. The impact that we seek is by looking at these ways to facilitate play and working through caregivers, professionals, systems, as well as governments. So this is the base of the work that we do. But then, of course, as we all know, in March, the COVID-19 really took the rug out from underneath everyone and shifted everything that people were thinking about in terms of children's learning and development in education systems and early childhood systems. And what the LEGO Foundation and LEGO Group did at that point is we made a $50 million commitment to support children's learning during the pandemic so that they could continue accessing learning through play, as well as to strengthen their resilience and in these difficult times. We came up with 4 streams of work that we wanted to pursue in giving out this $50 million that really was to be responsive, to support our partners going through unprecedented constraints, to build on this body of work that I've just described, to give attention to vulnerable populations, help systems to build back better where possible, and then really also use this moment to support transformational thinking. And this led us to 4 areas of our response, which I'm going to explain a little bit about next. The first area, we joined with the LEGO group to think about how our audience, or both parents and teachers and employees, all have children at home. So we thought we should share what we know, and that is fun, easy learning through play activities that people can do at home with their children. So this involved messages across all of our partners in many, many platforms, but we also developed a playlist that is on our own website that you can sort by age, by the materials you have, by the amount of time you have. So it's really curated and it's constantly updated as a resource for everyone to access. Next, we partnered with the LEGO Group to give out 80 small grants to actors working at the community level in a corporate social responsibility response, where the grants are helping meet basic needs, supporting crisis centers, enhancing education and learning, and providing mental health and psychosocial support, all through learning through play. Next, we supported our partners to look at how they're continuing their work and in many cases pivoting their work to respond to the crisis with learning through play. And here are many of the partners whose logos you see here. We help them to promote some bold thinking, and we saw responses like some of the ones that Dr. Yoshikawa was mentioning, as well as telecounseling, creative videos, radio instruction, back to school campaigns, etc. And then the final area is the distance learning and response area, which is actually the one that I led. So I want to spend a little bit of time looking at early childhood distance education responses that actually aren't this range. This range has to do with some of the older children's settings that we were looking at. But I would give you 4 examples of the work that we're doing in the early years. And the first is thinking about sort of the adaptation of pre-COVID practices to equip parents for providing play-based early learning. We've partnered with Stellenbosch University, as well as their partners, the Rigo Psychosocial Support Initiative in Africa, as well as the Africa Early Childhood Network. And this team is focused on caregiver-child interaction around book reading and play. And in pre-COVID times, they had demonstrated the impact of their approach for parental responsiveness, parental mental health, as well as child social, emotional, and cognitive development. And so the question became, could they do this via other means? Could they do it virtually? And they're testing different ways of doing that in Uganda, Tanzania, and Zambia. So we're looking forward to learning from that. And we hope that, as other speakers also have mentioned, this type of approach, we can maybe amass all this evidence and really start to learn about what works best in different contexts. Another example comes from the US that also looks at linking parents, but this time with schools, preschool programs, kindergarten programs, here in disadvantaged communities of the US this time, to look at how can we enable parent-teacher collaboration around playful learning so that we're ensuring the continuity. This was done in a 1 classroom pilot over the spring by Tools of the Mind. And now we're going to look at doing it across 15,000 children and their parents via an app, an innovative app-based approach to, it's really focused on reading, writing, and pretend play in the home. We're hoping to learn if we can do this across multiple platforms, languages, school systems, and US states, all while also thinking about whether or not it can be done via after-school programming, summer school programming, or even potentially directly to the parents. Our third example is one of learning by doing, as well as building back better, and it's here in Denmark, where there's a series of COVID-19 related investments and learning efforts that we're doing. This picture you see is of the Sofa School, as they call it in Danish, the Sofaskolen, and it's really where a textbook publisher began innovating their lessons online. So they would go live in the morning, and they would set the children off on project-based learning. The children would do the projects, have some lunch, and then upload their responses and their products, and then there would be another session in the afternoon. And this is what the part that happened while the schools were closed. But then once the reopening began, it took a shift towards what can we learn from that for blended learning, for building back better, for thinking about what creates a more animated lesson in the classroom and uses some of these technologies. And how can that enliven mandates that were set around the safety of children, like being more or outside more often, longer parts of the days. So that was another way that we were thinking about not just the response, but then how does the response inform education systems going forward. And similarly, but in a different phase of reopening, we're working with colleagues in South Africa to support the Department of Basic Education's E-Cubed initiative that wants to implement a shorter curriculum, but with more project-based learning. So this effort is featuring a system of sort of rethinking a shortened curriculum, but then also adding virtual supports to teachers via WhatsApp. So many of these are in their very, very early days. But as you can see, our learning agenda is quite rich. We're trying to figure out if proven in-person parenting programs can replicate impact virtually. We're looking at whether a proven school-based program can engage parents to ensure learning continuity. We're thinking about whether lessons from lockdown can enliven reopening, and whether play-based learning can enliven fewer subjects to ensure foundational learning. So I hope if you're exploring some of these topics, we can join forces, we can sort of pool our evidence to learn more faster for these early learning important topics. And thank you. There's some information to get to know the LEGO Foundation a bit better.
That's great. Thank you so much, Amy. Very exciting again. And I can see quite a few comments happening in the chat box. So obviously you've created a bit of a furore, which is always welcome. So I'd like to, I think, Saba, you might have prepared Sean to, that we might ask him to speak earlier. Sean is one of our guest speakers. As I've said, he's based at the World Bank and heads the Early Learning Partnership. Sean, if you can just take a couple of minutes to talk about this theme, and then we will open up the floor and get our participants to respond to the question and questions that have been raised for the first half of the webinar. Over to you.
Great, can you hear me?
Yes, I can hear you.
Okay, perfect. Thanks very much, Munaza, and thanks to ITA for inviting me to make some comments this morning. I think these are really fantastic presentations, and very happy to be part of such a distinguished group. As Munaza mentioned, the bank's Early Learning Partnership, or ELP, is conducting a multi-country research program on strengthening early learning systems. And this includes partnership with ITA working in the Punjab province of Pakistan. We're also active in Ethiopia, Liberia, Tanzania, and Jamaica. And I think one of the things that strikes me from our work and from the presentations we've heard is that the COVID crisis is really amplifying the challenges and the weaknesses that were already there in early learning systems. We know that when early learning is weak, that leads to low learning levels in primary school, churn and repetition. And so to the extent that we have a crisis-driven weakening of early childhood development, that's really not going to stay contained in early childhood education systems. In a worst-case scenario, what that will mean is that we have an entire generation that's going to be on a lower learning trajectory. Also wanted to amplify what the presenters mentioned about stress and violence. To the extent that these are increasing, we know that stress hormones can disrupt early brain development for children and cause long-term damaging effects on their learning, behavior, and health. And we are also doing some household surveys with the World Bank. We don't have too many results in yet, but to the extent that we do, including in Jamaica, which is one of our focus countries, we can definitely see heightened stress, parental concern, not only about the health issues, but also about learning, and increase in harsh punishment for young children. Wanted to go back briefly to what Bela said at the beginning about prioritization of early childhood education. This is one of the issues we've been looking at in this research program through a political economy framework. And early childhood education was already what we would call a neglected issue before the pandemic. And we're going to be looking over the coming months at how governments are prioritizing or not early childhood in their responses to the pandemic. But our previous work from the pre-COVID era suggests that while governments in many cases buy into the evidence on early childhood education, there's a lack of the conditions for sustained commitment and funding. And that includes a lack of political entrepreneurship at the national level, a lack of visible national champions for early childhood, and a lack of a coherent response from civil society. So that's just to say that the advocacy role of organizations like ITA and RNAC are very important in the current context. We've also surveyed some of our partner governments in the Caribbean, which is the region where I primarily work. There's a blog post coming on this, but we actually asked them what they were best prepared and least prepared to handle in terms of different aspects of the COVID response. What they said they were most prepared to handle was modification of national assessments, which is very frequently a high priority topic for governments, but not of very much relevance for early childhood. The second tier was maintaining nutrition programs and hygiene kits, and governments felt they were least prepared to provide resources to schools for distance education and to train teachers. basically 0 of the governments we talked to felt that they were well prepared for that or in a position to reach the majority of children within the first few weeks of school closures. So just to wrap up, in the interest of helping meet those needs, the Early Learning Partnership with support from LEGO Foundation and our other funding partners has provided grants to 29 countries, which we expect will reach 19 million parents and children immediately, but also leverage hundreds of millions of dollars in the coming years as the grant activities are scaled into larger COVID response efforts. So that's really our model, is to try to be a catalyst for greater government investment in the early years. That includes radio and TV programs for children, programs directed to parents through various media, radio, TV, mobile, internet, public information campaigns. Also, measures to accompany cash transfer programs to ensure that we're targeting the most vulnerable households, distribution of learning materials to homes, and training for teachers and health workers. And finally, measurement. I think that's a very important agenda that we don't want to lose sight of in the context of COVID, is ensuring that we're properly measuring pre-literacy, pre-numeracy, social and emotional skills, and other critical early learning outcomes. So thank you very much again for inviting me to be part of this presentation, and I'm very excited to hear more in the second half about what's going on in Pakistan.
Wonderful. Sean, thank you so much for giving us information about all these different endeavors. It's quite interesting and like heartening to hear about things that have been happening. And some of the things that you're saying are things that we're hearing about governments not being able to reach the most marginalized. It's really something for all of us to think about. Now, I wanted to take this opportunity as the moderator to just kind of highlight, before we raise some questions and answers for the panelists. Sorry, I'm going to take the liberty of just highlighting in my position, as Bela mentioned, I've been working with ITA for many years now. Some of you might know that I've been engaged with them for, I can't even remember now, I think 10, 11 years, if not more. And one of the things that I was involved with them in was at the very beginning, since the inception of the annual Status of Education report. And I think it's worth highlighting that ITA has been engaged in collecting data on early years since the very beginning. And even when it was not the hot topic, as Bela said, I mean, ITA started the thinking around early years very early, in the early 2000s, when it wasn't a hot topic. So we have been collecting through USER data on early years, on quite extensive data. And I mean, it's been something that I think we are quite proud of. And if you haven't looked at it, I urge you to have a look at the USER reports from the past many years to see what we've managed to collect. The other thing I wanted to highlight is, because Sean has just come and talked about the Early Learning Partnership, that ITA has been is the partner for the Early Learning Partnership program for Pakistan, and we have collected data and done surveys. And if there's anything that you want to know about that for on early years for the Early Learning Partnership, Saba is the person to turn to at ITA, and we have basically provided really groundbreaking research on the challenges at the systems level for early learning, and the government actually has taken on board these as well. So I just wanted to talk about this before because I heard Sean speak about this, so I thought it was a good opportunity to mention this in case people are not aware about this. And do ask Saba Said, who is the organizer for ITA, on ITA's side, to help you if you want any resources relating to this. I'd now like to ask Saba, is there a way for us to put up the questions that have been raised for the participants, so that, you know, we can have different, so how do we want to do this? Are these questions for all participants, or are they addressed to individual participants? Okay, so they are for either all or for individuals. So I would request, perhaps if we start with the bottom two, because they are targeted to Evelyn and Hero, and then the first two perhaps somebody else can respond to. So Evelyn, do you want to go first?
Sure, yeah. Okay, so the question is about, you know, how does coping ability for families work in ECD? The level of stress, you know, faced by parents, you know, and caregivers, as we have seen in most of the surveys done to date, really affect the situation, you know, emotions and behaviors of young children. And so parents and caregivers need to understand the children's fear, anxiety, and stress. If parents are having difficulty coping, it would be difficult for them to support their children's learning, and development. So I think that's why it is important, as we have seen in the couple of examples I've shared earlier in my presentation, to really support parents and caregivers with a lot of activities that would allow them to engage their young children more meaningfully. And most of these activities which are proven to be fun and effective would be those that are play-based, type of activities. So I think there is a very clear, link between the ability of the families, of the parents and caregivers, to cope with the situation, with the stress they're experiencing and the challenges, for them to be able to support, the learning and development needs of their children, especially the young ones.
That's great. Thank you, Evelyn. Would you like to respond to the question on the screen for you?
Sure. So there's like a few of these. First, I think ECE for special needs children, I believe the Peruvian example, they do share targeted messages for parents of children with special needs. And I have heard of some center-based facilities opening just for special needs children in some countries. So those are two responses, but would love to hear more in Pakistan and elsewhere. The TV phone learning effective? Yes, this is the big question. I think Amy Jo also posed this question. Are these approaches as effective for parents who don't have access to in-person ECE or in-person parenting interventions? I would have to say it's a big question. We're evaluating it presently in some of these impact evaluations. So we don't have results yet, which is, I think, the second point. I think one of the challenges, for example, is that a hallmark of many parenting interventions, if it is in person, is the opportunity for a home visitor or facilitator to demonstrate an activity for a caregiver to practice and then receive feedback. And that becomes much, much more challenging on the phone. Just to say what some of the challenges are. On the other hand, I think a relationship, rapport building with caregiver under extraordinary levels of stress, the caregivers appear to be very responsive to this phone-based interaction with an adult, asking them about how they are doing and about their role as a caregiver in the current time. And so what we found also, even in research, is that phone-based surveys, we get a very high response rate across different country contexts, including with vulnerable families, such as refugee families, in part perhaps because of the lockdown kinds of situation. Back to you.
Sorry, yeah.
Yes.
Sorry, I'm trying to unmute myself. That's brilliant, thank you. I think that takes care of the first set of questions. One of them was, I think, more of a comment. And I'm sure that, as Bela pointed out, lots of responses are coming in the chat box as well. So it's
Dr. Manaza, there was one particular question for Dr. Hiro, which I would like to ask.
Okay, go ahead.
That the Aran Simsim initiative serves children who have experienced the profound adversity of displacement, uncertainty, and in many cases violence. So is there any reason to believe that these children may be better able to adapt to COVID-19 as uncertainty has already been normalized for them? Or is COVID-19 yet another potent risk factor?
That's a very good question. I don't think we have the research yet on this, though we should be able to learn more fairly soon about this. I would say the research in kind of early development would suggest that these are, when risk factors accumulate across different periods of the life cycle, they can, unfortunately, they can often exacerbate each other, which is that risk can build on an earlier risk, placing a child at increased risk for later learning problems or problems of well-being and behavior. So it is not that promising, I would say, from the other research literatures that are relevant, such as on prior economic shocks or on natural disasters or pandemics of the past, where we see that accumulation of risks can indeed worsen children's outcomes. So that all highlights, I think, the urgency of the response right now to mitigate risk through the policies and program actions that were in all of the examples from all the speakers so far.
That's great. Thank you so much. So I think the next set of questions we have, some of them are, I think Amy can see the one that's specifically for asking it from her. But I think there are two questions that I think pretty much anyone in the panel can try and respond to. So I welcome all kinds of comments. But Amy, if you can please go first.
Sure. So I think absolutely there are always options and opportunities for playful learning when there isn't access to toys or playing materials. And many of the types of programs that the panelists we were all describing have plans for sort of local materials types of work or just no materials types of work. It isn't to say that you need to have sort of Legos or any other sort of sets of complicated manipulatives. You can use stones, you can use rocks, you can use leaves, you can go on hunts. All of these things sort of take a playful way to look at what is in the surrounding and use it. And I think I wanted to add to what Hiro was saying about the learning from these new ways of working in parenting groups. It could be that we find an equitable solution through these approaches. If we can learn about what the right ways of taking up the conversations, either via phone or whether the population has access to phones and WhatsApp, what are the ways that we can make connections? What are the ways that we can sort of promote a relationship and build on the desire to have a conversation and relieve the stress and think creatively about playing with children? It could actually provide us with ways to sort of shortcut the reality that only about 20% of the world's children have access to early childhood education at this point. So I think there is sort of the dire crisis that we're in, but then also a need to look when we're thinking about making early childhood learning more equitable. Maybe this crisis offers us some opportunities to learn things about the ways that we work and the ways that our systems work that really transform them in and of themselves.
That's great. Thank you so much. Does anyone want to respond to the first two? How can we make early childhood learning more equitable, and how can we gather our children as all our students in one platform? I think I'd like to add a little bit to this, just to say that, and maybe some of the panelists can respond together to this. I mean, one of the things that has always struck me is that when parents are facing really severe health and economic challenges, playing with a child can often, or just kind of focusing on children's mental well-being, becomes like almost secondary in nature. It shouldn't, but, and then, when they have, for example, older children who are missing out on critical years of schooling. So how do does that somehow factor into the work that you guys are doing? Because that's likely to widen inequalities even more or create even more issues. I've thought about this quite a lot. If somebody doesn't have enough money to feed their family, I mean, then playing with a child or kind of engaging with them may take almost like a secondary, it may become like secondary rather than remain important. So how does that factor into the work that you guys do?
I could say that from the implementation teams that we are in touch with around the phone-based models in the Middle East and in South Asia, there's absolutely the need to do a check-in on basic needs first, and those become the first priority. So you may not get to the activity. The activity is, I think, across the models I presented, always kind of last in the order. So there is a kind of basic check-in. There is training in crisis intervention and active listening and empathic listening skills that is really necessary for that first part. There are COVID messages and health and nutrition access messages that come first often, and then you get to the activity. But absolutely, if a parent is under very high levels of stress, you may never get to that activity in that phone call. It might take a few phone calls to even get to the point of talking about parent-child learning activities.
That sounds great. Thank you so much. I just want to say that I think Sean's brought up a really interesting point about children with disabilities and how it's important to adopt a twin track approach. So I'd urge people to look at the comment that he's made. It's a very good one. So I think we don't have much time, as much as we want to stick around and talk a bit more. I'd like to swiftly move on to the second half of our presentation. I'd like to welcome Dr. Nadia Siddiqui as the first presenter of the second half. So over to you, Nadia. Have you started speaking? Because we can't hear, I can't hear you.
I've unmuted myself, and can you all hear and see my screen?
Yes.
Okay. Thank you, everybody. It's a great opportunity to talk here about very important issue that everybody, all countries are facing at the moment. And just wanted to go back to the basic. Equity has been achieved in this crisis. I think we are quite equitable since the time period we have begun whatever has happened. We are quite equitable in a sense that we are 22 million children who were not going to school, and we were thinking that they are a disadvantaged group. Actually, nobody is going to school now. So that's what we see as equity, where nobody is going to school. And we have seen what learning loss has happened, what kind of challenges teachers have faced, what kind of challenges schools have faced during this time period all across the world. And there is nothing, I won't say that challenges faced by Germany or England were different from challenges what have been faced by Pakistan or India. So there is a commonality in challenges, and we have seen that this is something we are going to address in the next few years as a global world. So another important thing that we are all talking about, a lot of crisis has happened, health, economic, financial crisis. There was a research crisis at the same time. So we got funding for a little project in India and Pakistan, and we were very lucky to get that funding from British Academy. And they were interested in finding answers to the question, how can we make learning equitable in early years? So this project, basically, we got the funding, we had very good research questions, but actually we were hit by COVID-19 crisis. So first half of my presentation would be to tell you what adaptations we have made in the project to meet the aims, rather than just stopping it there. We just continued doing it, and there are some lessons for the researchers community. There are some lessons for the policymakers here. How can they adopt some practices that we have used for research in India and in Pakistan? How can they use the same for the purpose of education in early years? And the second half will be going back to the basic, why we need early years education in context of poor countries. What does it mean? And where it is linked with, and considering that it is a very expensive project, motivating children to come to school, and the schools which are fully resourced in terms of training, material, electricity, and everything available in the school, it is an expense. And how can we overcome that? How can we do that? As a poorer countries, how can we manage that? So that's a question we need to ask during the crisis. and after the crisis. So this project is basically asking the questions. First is to what extent school readiness of children aged 3.5 to 6 years old is determined by early years of schooling. So when I say school readiness, I mean to say being independent, being ready to attend formal school, and being able to start learning in an environment where you are independent of your parents, where a child is an individual and trying to do things by themselves. So how much children's cognitive learning develop in a year? That's another question that's related with the research design of the study, that we are collecting data from India and Pakistan, and then we are tracking the same group of children after 12 months and looking at how much learning has taken place. The third is the most important aspect of the design, which is what are the differences in learning of children who attend school and those who do not go to school. So basically, this is kind of an assumption everywhere. We think every child goes to school. When you talk about this in England, Pakistan, Germany, even teachers in Pakistan think, oh, children go to school. No, all children don't go to school. Some children don't go to school. They don't have the means, they don't have the interest, they don't have the capacity. Parents do not have the capacities to send their children to school. So this unique scenario is prevalent in Pakistan and in some parts of other developing countries. So we could actually measure the learning of children who attend school as in compared to those who do not attend school, controlling for all socioeconomic demographics, controlling for all the thing that we think, okay, this contributes towards children's learning, or this contributes towards children's school attendance. We can control for that in context of Pakistan. This is a natural experiment. It's not a randomized controlled trial. It is just natural occurrence. We are comparing children who attend school and who do not attend school. Now the situation is COVID-19, where nobody is going to school. The impact of school is fading away. The loss in learning has already begun. And the most closest we have the example is the summer school, the summer holidays, where children do not attend any school time period in those months. But we are actually exceeding the number of days when children are in summer time period. We are gone beyond that. So what impact it has on children's learning and what role schools can play is an important question. So the study is in Gujarat and Punjab. We are trying to collect a sample through, in these two countries, we were basically in the beginning wanting to target household and try to get the data from all over all the state and all the districts in Punjab and Gujarat, having similar characteristics, socioeconomic characteristics, the cultural and political atmosphere is quite similar in these two countries. So we thought this is a comparable data to conduct the study. So enumerators were selected for the study, basically, which previously we wanted only household to be part of the studies, but now only people who are trained to conduct this test. We have a household survey and a test, and we are all doing it online, which were previously we were thinking to do a field study where surveyors or enumerators will go into the house and conduct the test and the survey in the house environment. But now we are using mobile technology, and I'll show you how we have done it and how successfully we have managed collecting data. At the moment, as far as I know, this is the only project which is assessing children using mobile technology, which is using all internet means to get that information from children and conduct it as rigorously as possible through proper training and rigorously monitoring enumerators who are collecting this information. Household survey where children are 3.5 to 6 years of age. Previously, we were relying on our lists of household, but now we can't do that under the conditions that you cannot just randomly knock at the door. We need only households who are willing to do that, and the enumerators have access to those households. So it's a wide range of households are part of the study. Enumerators are being asked to collect this information from a wide range, from the most rich to the most poor, those who go to school and those who do not go to school, those who have been dropped out, have never been to school, all should be in the pool that they are assessing, and from rural and urban communities. It's a longitudinal study. We will go back to the same group of children after 12 months, and we'll track the same household for information from their parents, what they have been doing during the process in that 12 months, and what changes have happened, whether they have gone to school or not, whether the summer schools have taken place or not. So this information will be followed back after 12 months. That's the beauty of this information. This is the beauty of this design, which basically trying to add up information and evidence whether early childhood education matters and what are the longitudinal outcomes of early childhood education. So we believe that in September schools will open, and somehow this process of learning will begin for those who go to school, will start attending school by some means, and those who are in home environment learning through online means will continue to do so after September. So 20 children are taken up by each enumerator, and so far we have collected a sample from Punjab, Pakistan. It's 514. In Gujarat, India, we have got 450. So nearly around about we are touching 1,000 nearly very soon, and which will be a good number of students to see, including those who go to school, those who do not go to school, those who go to Anganwadi centers or early childhood care centers. These all children will be part of the study, and we will analyze what is the impact on their learning during the crisis, what has happened when the crisis began, when we started the project, and what happened after 12 months when probably they will start going to school somehow.
So, I don't mean to interrupt you, just to say that we need you to wrap up in about 3 minutes, please.
So these are the domains we were interested in measuring in the beginning. So the yellow ones we could actually include in our assessment, and the ones which are not highlighted we could not make it in our part of assessment because they involve physical participation of a child in the test process, and we could not actually implement those activities through online means. So we have made a lot of compromises in terms of the validity of the test. So everything has been questioned in this crisis. So what is a valid, highly rigorous test is in itself a question thing here, but we have tried our best. Rather than stopping the project, we have continued, and we were quite successful in doing or in collecting information in these 3 domains and the sub domains which are yellow and they are highlighted here. So here are the results. You can see some early literacy and early numeracy results are available. That red dot show children are doing better. There is a trend here that they are doing better in numeracy rather than in literacy. And here is the overall trend. All children from India, Pakistan, and some children in England I also tested just for the pilot process. And you can see that children are doing quite well in letter identification, subtraction, addition, number identification, comparison. However, they are not doing as well as in digit memory, identifying emotion, expressive vocabulary. This is the most interesting finding. I can't see any major differences across these countries, India, Pakistan, and England, where I can say that children are consistently doing well. Despite that, England is well resourced in early childhood education as compared to other countries. There is no specific trend I see that children are doing better in England as compared to children in Pakistan and India. And in Pakistan, if we take out children who do not, if we take out from this graph children who do not attend to school or haven't been to early childhood center, there will be much more equity in terms of their learning. So what happened after COVID-19 crisis will be another question. what trends will look like, we don't know. Coming back to the last few things here, that early childhood care and education means readiness to start compulsory school. It means it basically targets cognitive and physical development. It is meant to provide health and safety to children. And the main important purpose is that their parents go to jobs. The labor force participation is the main aim of early childhood care and education, and women's labor force participation is the thing most strongly tied with ECE. So unless our women are not going to the real jobs, we can't see that we can this sector can really flourish as in other countries. So it's not compulsory before 5 years. What does it mean to go to an early childhood care center or a nursery or a pre-nursery or a daycare? And the situation is public-private.
Nadia, I'm sorry, I'm going to have to stop you. I do need to give time to the other presenters.
Yes, I will stop here. I will share the slides. Basically, I just wanted to share the findings of the project. Here are some policies here, and you can see the slides and you can see what I'm saying here.
That's great. So we thank you very much. That was very comprehensive. I'm just very mindful that we have to give presenters time to speak as well. So I'm going to pass it on now to Dr. Amna Ansari, please.
Thanks a lot, Dr. Manazza. Let me just share my screen, and meanwhile, also say a big thank you to ITA for organizing this webinar and for the opportunity to share our experiences and learn from each other. I hope my screen is visible.
Yes, I can see it.
Okay, perfect. So, so I'm wary of time, and I'm going to start straight away. I'll be talking about parental engagement for early childhood education in Punjab's context. But before I do that, I think I want our attendees to go through a bit of a mental exercise, and I'd request everyone to put on their imaginative hats and imagine the time that they were a 4-year-old. So go back in time and think about being a 4-year-old, but in a household in Punjab. And for those of us who are not very well acquainted with the context, I want to share some statistics with you to paint a picture of your childhood. So on average, the probability that you are attending an ECE program while being of ECE age in the province is just 34%, just about a third. The probability that you have had a parent or an adult interact with you for a learning activity in the past 3 days is fairly low. It's even less, 28%. So that's already, a very boring childhood. To make it worse, imagine that almost all of you would have no more than 3 children's books to look through, to enjoy, to explore, and that's the best that's available at home. There's only a 50-50 chance that you get to play with, 2 or more types of playthings. And here, mostly one of the playthings is really a household object. So nothing fancy or nothing manufactured, outside, but just an available household item like a cooking pot or a piece of cloth, and so on. And the most alarming and striking of all, you are highly likely to be subject to violent child disciplining. This is all from the multi-indicator cluster survey, mixed survey report findings from Punjab. There's an overwhelming majority of 3 to 4-year-olds, children that young in age, who are subject to psychological aggression as well as severe physical punishment. So that's the kind of childhood that you're likely to have if you're growing up in a household in the Punjab context. But this was all, the pre-COVID scenario. Come COVID, and let's see what happens to, this already bleak picture. The impacts have been talked about by, all the distinguished panelists before me. I'll try and make this fairly quick, but picking on from the last slide, violence and abuse. If you look at, evidence being shared by WHO, by UNICEF, and others, there's very good reason for us to believe that there's an increased risk of as well as increased incidence of violence and abuse. Now, most of the violence that children face occurs at home, and in the majority of countries, for more than 2 in every 3 children, they're subject to violence. So imagine what happens when they're spending almost all of their day at home and are completely cut off from avenues available for support and protection, like school, teachers, friends, and so on. Secondly, the devastating impacts on health and nutrition. Emerging evidence from, Lancet Global Health shows that there's likely to be a great increase in malnutrition, and several million children are, likely to be impacted, not just by malnutrition, but there's going to be an increase in child deaths, as well as thousands of maternal deaths due to the disruption in ongoing health services, as well as other factors like reduced availability, reduced uptake of services due to fear of infection, reduced access to services because of transport issues, economic impact of COVID, and so many others. And likewise, quality of parent-child interactions. I've already hinted at violence, but all the speakers before me also made a mention of how COVID is impacting caregivers' mental health. There's heightened stress resulting from work or loss of work, the economic impact of COVID, from illness or fear of illness, anxiety, etc. And our children are very perceptive at reading our anxieties, at picking them up. So we really transfer it to them, and this anxiety on both ends is likely to adversely affect the quality of parent-child interactions, which, like I said, in the Punjab context is already quite bad. Turning to play. Of course, there are fewer opportunities for play. There's also some evidence suggesting that, children have few opportunities for physical activity, and, there's more sedentary behavior. Of course, with your cousins, your neighbors, your friends, in sort of a lockdown situation, and particularly in the Punjab context, with the streets, the cricket playgrounds, the parks being no longer available, it's really hard to imagine, children enjoying play or having substantial and meaningful opportunities for play. And finally, in terms of return to school, recently our colleagues from the bank have run simulations and really arrived at catastrophic impacts that COVID can have on learning, and the sheer amount or magnitude of learning losses accruing to it. And we also know from from our previous learnings from the Ebola crisis that such times are likely to result in drops in enrollment, particularly for female students. And like I said, there are both short-term and long-term impacts on educational attainment and the quality of learning. There was already mention of, forgetting what you've learned at school during this time. And of course, that's further aggravated, the existing learning poverty is further aggravated by, this reduced likelihood of returning to school and being able to learn. So then the question really becomes that amidst, all this, how can early learning really be promoted at home? And in terms of, the global response, we've seen an overwhelming response and a range of activities and programs that address the need of the hour. So, for example, within protection from violence, we have countries which have responded with information campaigns on violence protection and psychological support on actually providing new services for women and children who are subject to this violence, and then also training frontline workers to identify and respond to child protection issues. In terms of health and nutrition, there's an emergency response stream catering to food deliveries to pregnant women and children, also promotion of family hand washing and hygiene, particularly in low resource settings, and equally importantly, the use of health and nutrition platforms to deliver other key messages. So, integrating messages on protection from violence or early stimulation and learning with health and nutrition. And finally, this last leg, which I'll just be talking more about in a bit, early stimulation and learning. There's again a range of activities that can be done to support parents and children. Children, including distribution of books, learning and play materials, integration of ECE into distance learning programs, as well as creation of new digital content as educational entertainment for these young children. And finally, parental support through messaging on coping and parenting strategies. I haven't made a mention of all the economic relief sort of programs or social protection programs that can also incorporate at least part or most of these activities with them. But it's really this last leg that we're trying to implement in the Punjab context through a small early learning partnership supported project. And the idea really is to provide very specific information and services to parents to engage in early stimulation with children, not just during the crisis, but also beyond. So the aspiration really is that through this behavioral communication, through this engagement, we'd be able to have a slightly longer term impact and change the nature of these interactions between young children and their parents. So the strategy that we're adopting is really three-pronged. Firstly, we're developing some public service ads, which will look into supporting parents with coping, dealing with high levels of stress, and then also some tips for positive and playful parenting. The second stream is, developing new educational content for children. We witnessed, in initial responses by the government, both the provincial and the federal government, that there was a slight sidelining of early childhood education, distance learning programs, and we thought that this might help us increase the learning opportunities that are available for children at home during this time. And finally, the last stream is developing some parent activity cards to encourage positive playful parenting and play-based learning for children. Now, just 2 points to mention here very quickly. One, that we're trying to maximize outreach through all available media, phones, radio, local television channels, etc., government channels. And the second is that we're trying to align this as much as possible with the provincial pre-primary curriculum. But the parting...
I'm sorry, I'm going to have to cut you off. You're over there, and I still have another participant, and I have a guest speaker, and we all have limited. Thank you so much. Your slides will be the very last one. Thank you. I'd like to invite Abdal, and please, Abdal, if you can keep your presentation to under 10 minutes, so I can give Madiha an opportunity to speak, and then we can just wrap up. Thank you very much. I will call out if you exceed the 10 minutes. Thank you. Over to you.
Assalamualaikum, ma'am. Thank you so much. Rest assured, I think I'll keep it to 10 minutes, even less than that if possible. I think first of all, it's very befitting and also a bit overwhelming to come right after Amna. So Dr. Amna is an ex-colleague. She's the one who actually, I think, initiated the ECE rollout in Punjab. So I apologize, Amna, if I say anything that is out of the line. So I think we can get straight away into it. So next slide, please. Right. So what we basically wanted to talk about was largely, I think it's lined in a sort of very productively in what Amna was saying, and then how the government in some form or the other has responded during this time in terms of ECE, and all just to ensure that there is continuity of service delivery during this time. One footnote at this point that I think it's important for everybody to understand that a lot of this is first response. So when you're in the government, the pressure is that you need to respond. So at times the idea is to roll out an intervention by collecting enough evidence to ensure that you're going about it the right way. Next slide, please. this is the overview of how the presentation would look like. So it's briefly a context of EC in Punjab, impact of COVID, then planning some of the activities that we planned, and then the way forward. Next slide. Right, so this is a brief overview of what ECE intervention in Punjab looks like. So ECE in Punjab is actually quite young, to be very honest. It's not been implemented for a very long time. So largely we see the roots of ECE in Punjab a bit or somewhere around 2015, but when the project was really sort of taken in terms of like policy intervention, it was somewhere around 2017 when first ECE policy was drafted coincidentally by Dr. Amna. The policy basically described and defined what the key contours of ECE would be like, and what are the key parameters and the quality standards that need to be maintained in classrooms all across the province if you are going to roll out an ECE classroom. So a brief overview. So we have somewhere around 90,000 to round it up 100,000 children enrolled in these classrooms. We have 10,000 plus ECE rooms. And when I say ECE rooms established, we don't mean ECE rooms constructed. We basically mean that there's a room within a school that is dedicated as an ECE room. So there's no new construction of schools happening. We have a 2-year ECE curriculum that is approved, but important to note here that this curriculum is not implemented. We are still in a 1-year modality in Punjab. So the ECE that we see in Punjab is a 1-year ECE, not a 2-year ECE. And it becomes sequential with the Kachi system that is still very much implemented all across the province. So in most cases, it is ECE, then Kachi, and then 1. Lastly, so there's quite a lot of training that happens in order before a room is developed into an ECE room. So we train head teachers, and caregivers, and also community mobilizers, which are in the school council committees that are formed. Some of the key features of the ECE room that is developed is the room is painted. There's the ECE toolkit that is provided by the government. The ECE curriculum guide. A caregiver is hired, but on a part-time basis. And then obviously there's training of head teachers, caregivers, and school council members. We then, Punjab is this very rigorous and robust system of monitoring. So we have MEAs, which is a monitoring and evaluation assistants, and then AEOs who conduct regular visits, primarily for monitoring, but also to ensure quality assurance. AEOs are more aligned towards quality assurance. MEAs are more monitoring resources. So this is like a brief overview of what ECE in Punjab looks like. Next slide, please. So some of the impact. So this is very. I think not a lot of it is based on research. This is mostly in terms of our understanding through the monitoring system that we have in Punjab. So, but some of that is largely because of the decisions taken by the government. So one of the key effect was that when the schools were closed somewhere towards the end of March, and there was a province-wide, a nationwide emergency imposed, all trainings were halted, which essentially meant that you cannot train new teachers or head teachers. Another key aspect, which I think Amna also highlighted, was the retention of children, because when the schools were closed, the children were stopped coming to school. The ECE caregivers, because they were part-time, their remuneration is being paid through the non-salary budget. So schools do not feel inclined that they have to retain these ECE caregivers because they're contractual. So there's a considerable dropout of ECE caregivers, which then affects directly the implementation of ECE. Lastly, which is I think very understandable, is that the delivery of ECE kits and guides across the province was obviously affected because of the lockdown. Next slide, please. So to sort of connecting the impact of COVID with some of the interventions that were taken up by the department. Once again, I think a lot of it was first with this notion that there needs to be continuity of service delivery during this time, because you cannot suspend service throughout for somewhere around 6 months. So one of the key interventions, and I think this is something that we're now seeing that had better results than that were initially, I think, something that people expected, was live online virtual trainings. So one of the key interventions that we started initially was in order to ensure that the teachers and caregivers and the head teachers are still being trained, because summer is the time in which all of the trainings happen in Punjab, because apart from that, there's no other time in which you can sort of take teachers out of a classroom and train them. So we wanted to make use of that time and ensure that we do not sort of lose this opportunity. So we started doing online trainings of caregivers. This is very important to note. This is the first time this was done at scale in Punjab, that teachers and caregivers and head teachers were trained from the province by the department, all online. And I'll explain briefly going forward on how that was done. To ensure that the caregivers are still paid, so non-salary budget, we keep on giving to schools on a quarterly basis. We ensure that they keep on sort of paying to the caregivers. Then we are also developing an awareness strategy, and largely to ensure that when the schools reopen, the children are re-enrolled by parents back in school. And then lastly, what we've done is through our network of district education offices, we are ensuring that the kits are being delivered. Next slide, please.
So just to say, Abdan, you've got exactly, according to my timer, 3 minutes left. So you might want to prioritize some slides.
Sure. So I think we'll keep towards the training, because training is the major part. So training, the first phase, so training was of two major stakeholders. One was the teachers and other was the caregivers. We tried to test different modalities of training during this time. So there are 3 different modalities that we tested, and we're finding some very interesting results. So one was we tried online lectures, which is bringing people online on a Zoom call and then putting a master trainer in that call and giving direct training to that group of people. With the teachers, we actually found that to be very successful, and I'll share brief insights going forward. The second modality that we tested was that we shared the content with the group, with the trainees first, and then we conducted focus group discussions. The trainees were given a week's time to go through the content, and then in the focus group discussion, we sort of went about in trying to understand how much they've gained from that content, and then on the basis of that, we would actually ensure that if they are qualified to be an EC teacher. Lastly, for the caregivers, the issue with the caregivers is that because they're contractual staff, not a lot of them have the access to internet or access to any like a device, like a smartphone. So then the issue was the modality used with the caregivers was that the videos were shared on a WhatsApp group, and then follow-up was done through MEAs and AEOs to ensure that have they learned something during this time. And I can also share you some insights. Can we move forward, please? Just to ensure, so one of the issues with trainings is, especially with Cascade, is that if you don't put in a monitoring mechanism, a lot of quality is lost. So we selected 3 modalities, and you can look at the slides later on as well. One was that CAID's own education officers, they ensured that during this call, everybody was present and that there was transfer of knowledge. And during a Zoom session, there were representatives from PMIU, School Education Department, and CAID. And then follow-up visits and calls were made by MEAs to ensure that there was transfer of knowledge. Next slide, please. These are some of the statistics from the call. So one perception that everybody has in Punjab is that people just do not have access to internet at all. A lot of it is true, but it's not as bad as people think that it was. So these are some of the statistics. So a no is actually positive. This is double negative. So you can see that a lot of people, for example, phone storage, 97% people had phone storage. Internet connection, 87% people had internet connection. And then WhatsApp on phone, that was largely a problem, but still 73% had access to WhatsApp on phone. Next slide, please.
No, sorry, Abdal. I would have to stop you. Really sorry. It's really true. As humans, we think we're going to take far less than we actually do. I've been in this position many times myself. Thank you very much. Yes, it was very interesting. In fact, I'm really looking forward to seeing your slides, because this is something that I'm quite interested in focusing on myself and finding out. But for now, I wanted to give Madiha Ansari an opportunity to speak briefly, maybe 3 minutes, please. And then we will open up some of the questions and literally just conclude. We've got about 10 minutes left. Over to you, Madiha.
Thank you. I'm sorry, Abdul. This has been such a rich discussion, and it's been great to learn about the creative ways in which organizations have been reorienting in the new normal. I'm just coming away from another conversation this morning around the role of play in education, and all these ideas around how important it is to reach children at a young age have been reinforced when their brains are developing at such a fast pace. One of the ways in which Cities for Children as an organization has reoriented and pivoted to adapt to the new normal has been through the adaptation of a child-to-child early learning model, which I think will be relevant to a lot of maybe members in the audience as well have been asking questions around what happens in low resource contexts and what happens without digital options. So, so we've worked on this adaptation of a peer learning model, which we're calling Siko Sikao Sati, or the Partners in Learning program. And this essentially equips older children in grades 4 and 5 to deliver playful learning sessions to younger kids in sort of at the Kachi level, going up to grade 1. And so yeah, so this is relevant, especially for children who don't have access to digital options, who do fall through the cracks, and who live in close quarters and close communities, like the urban slum settlements that we work in and that our partners work in. So we've taken these child-to-child based materials and added in sessions that use low-cost materials for playful learning. So these include things like threading and building motor skills for young kids, or making objects through clay, or recycling everyday objects. So these ideas are being included. And we're also going to be liaising with a Montessori group and taking ideas from the teachers and principals and incorporating them in the program. The other thing is that in terms of the Montessori philosophy, there's so much that children can be learning from their parents during this time, even through everyday activities, as long as it's done in a mindful way that engages them, that reinforces their language skills, that reinforces their motor skills. And that is really something that I think we have, this is a time of potential to kind of explore that. So what our sort of micro level solution and what this program does is to provide the opportunity in a sort of in a safe environment. So mostly it's children in their neighborhoods, and mostly sort of with cousins or siblings who already have contact with each other, to recreate a sense of structure and normalcy even while schools are closed. It's the opportunity to keep them engaged in learning and to provide respite from the kind of stress that all the speakers have been talking about, especially in places where parents are facing higher stress and there are protection risks involved. So there's a safe space where children can disconnect and do fun things and learn. And the third idea is that we want to keep them motivated to return to school and sort of retain the skills needed to ease the transition back into schools when they do reopen. So as a guest speaker, I don't know, I think I may have outrun my time, but that's what we're doing right now. I'm looking forward to taking things forward.
That's brilliant, Madiha. You timed it beautifully. It's nice to hear crisp and clear things as well. So thank you very much. And so I think this brings us to an end. I do think there are some questions. We've got about 5 minutes, I'm guessing, for that before we wrap up. I feel like this has been an extremely rich second half as well, and very nicely regionally focused. Do we want to put up the questions to the panelists? And whoever is responding, please, if you can just be very brief. So we can just kind of, so there's lots of questions for Nadia. So Nadia, over to you.
Can you see me? Hello? Yes.
Yes, Nadia, we can hear you.
So there are children aged 7 to 8 who are still in ECE. Does the survey include them? So no, we have included children who are until the age of 8, But for the analysis, we might exclude them because we want to have a standard. So the way we have collected information is asking the exact date of birth from children, from their parents. So in this survey, we will do proper analysis with age 5, 6, 7, and until 8. Our standard age that we expected in enumerators was 6.5 years of age, but we did ask them if children are interested or parents are interested in bringing them in the process of testing or survey, then do not stop them from being a part of the survey study or the assessment activity. So as COVID-19 will affect research results of student learning, so how do we plan to use it further? So I think there is, we can use the findings for further research or for further policy development. So first question we will answer that, what is the role of ECE as in physical space, as in school settings? So how can, is it that specific atmosphere of school that makes a difference? So currently we cannot answer that, and there is very less evidence whether ECE is effective. And we have a lot of evidence that say that ECE effects fade away with passage of time. So there are some positive and immediate effects, but as the process moves forward, when children grow and they come to the education, move into secondary schools, what they learned in ECE learning, it fades away. So that's what we are trying to answer in this study.
Great, thank you, Nadia. Can I ask Amna to please respond to the questions as well?
Sure, thanks a lot, Dr. Vanessa. I'll start with the second one first because that should be fairly quick. So the parental activity cards under this project are basically, they're intended for parents and they have fairly straightforward ideas for activities to do with children. So they will carry as much appeal for a literate population as for an illiterate population, because we'll be using the power of visuals to communicate ideas. And there was another question about, whether household items can be used. Absolutely. These are, very context-specific ideas about what you can engage your children in with what is readily available. So really no resource sort of requirements for these. For example, just making faces in front of a mirror to teach children about emotions or identifying emotions, or drawing with your finger in the air, or with a stick on the surface of water, etc. for writing. For the second question, which is about perceptions, yes, that's I understand the challenge there, but I guess advocacy and awareness is of course hands down the first solution. Also seeing is believing. So when EC was rolled out in Punjab, I can tell you that parents did not understand what it meant, but they were so happy and overwhelmed to see their children in these classrooms and learning. So likewise for parental involvement, once you set off, and once you through these long-term behavioral communications try to address this, I think it's only a matter of time that this will be resolved, just like the EC intervention itself. Thank you.
Thank you, Amna. I think there are still a few things happening in the chat boxes, but I think we have in this very rich discussion with extremely wonderful presentations from the Asia Pacific region, from the Middle East, from the Lego Foundation, from the Pakistan. I mean, for me personally, all these, they all kind of come together so beautifully, and Nadia's research, Amna's work, I mean, Abdal's, it all comes together so wonderfully. And I personally have really, really enjoyed, for the first time, seeing many of you actually. I've read your work or heard about you, but never really seen what you look like. So it's a great opportunity to engage with everyone, even though it is virtual. I think we can take away a lot from this. I think, as Bela was saying, if we just go back full circle, one of the words that I think we have heard again and again in this in the last couple of months is that this is unprecedented, and indeed it is. But I also feel like this provides us as a community a great opportunity to actually make changes that are long-term beneficial for young children and for children across the world. I think, Nadia, one of the things she said really struck me, that finally we're all kind of almost starting from a place of equality in some ways. I suppose it's sad to say nobody's going to school. How we manage and chart out these children's pathways over the next few years will be extremely important. I'm grateful to Sean, to all our participants, or to Madiha, to our guest speakers. I'm sorry, Bela, I may not be able to give you an opportunity to speak, but it was a great opportunity to engage with everyone. I think Saba has already been saying on the chat box, the slides will be available. And I really do hope that we can continue to engage. There's a lot of exciting work that I know that ITA is doing, and we will be doing more of that. And we're quite excited about it. So please do ask us, and I'm also part of the ITA team. I'm very happy to respond to questions. So thank you everyone for all your time. Bela, we've still got a minute if you want to come in before we let everyone go.
Thank you, Munaza. I'm just so overwhelmed. I mean, you know, every panelist, you know, starting from Evelyn to Hero, to Amy, to Nadia, to Sean, to Amna and Abdal, and also to Madhya. I mean, it's just awesome. And thank you, Munaza, for being there. And you know, the number of communities that have come together as participants who are really practitioners. I'm sure lots of ideas from here, desperately needed at this time. But my last plea to everyone is, let's become a great advocacy and action group with lots of great practices that must influence action and space for EC, with backed by finances at local and of course global levels. We are being squeezed out, and there is no room for our young ones to be squeezed out. They are the ones who are going to change education and the entire education landscape for our countries and societies. Thank you so much for being there on behalf of IT.
Sorry, Bela. Thank you, Bela. The panelists, can you just turn your cameras on? Sabha wants a photograph. So before you can leave, can we just have the panelists turn their cameras on? Thank you. Thank you, Bela.
Oh no, I think we lost. Oh, there's Angela.
Can you see us all? Can we see everybody?
Hamza, can you please confirm the photo has been taken?
I can't see the full screen for some reason.
Yes, Ms. Sabha, it's done.
Okay, thank you. It's done.
Thank you, everyone. And sorry if I cut people off. Very rude, but I had no choice. Thank you very much.
Thanks, everyone.
Thank you, Vanessa. You did a great job. Lovely. Bye, Amy. Thank you.
Bye.
Thank you, Hero.
Thanks a lot, everyone. Bye-bye.
And everybody is desperate for your PowerPoints because I think they were smashing. Absolutely very useful.
Thanks a lot, Bela. Thank you.
Thank you, Bela. Thank you so much for organizing. I'm so proud of the fact that we have done this. Thank you so much for giving us the platform.
Thank you. Thank you. Thank you, Madhya.
Thank you.